Assalamu alaikum and welcome to the Dr. UUT channel. Topic of the day is feedback loops. Lecture is available in Urdu, so let's proceed in English. As usual, what is meant by the term feedback loops? Feedback means feedback means to help out or to support, you can say. And loop is a circular path. So a support in a circular path is called feedback loop. Well, biologically and physiologically, we will define this that in the feedback mechanism, what will happen, or in the feedback loops, a loop is formed like a system is there. This system will release some products, and these products will then activate or will react or will come back towards the system to do its job. So here is a kind of a loop. Now this is called circular path. A loop is here, so that's why it's called as a feedback loop. So in biological terms or in the physiological terms, we have got two types of loops. One is called a positive feedback loop and another one is called negative feedback loop. Now what happens in the positive feedback loop? In this, the body will go towards an unstable condition, or you can say an extreme condition. In negative feedback loop, the body will move towards a stable condition, or the body will come in a stable condition. Why? We'll understand this when we go through examples. First of all, how this is functioning. There will be a kind of stimulus to your body. A message should be given to the body. Then that message should be detected by the part of the body known as detector, wherever this message is given, or to which part of the body, to any part this is given. Then that detector is supposed to send the signal to the control center. Control center will then release some products, and those products are responsible to do their job. Means whatever the detector was supposed, whatever the detector detected, for that the product will come and will do its action according to that signal. So now this here, you see, a loop is here. That's why this is called a feedback loop. A system is getting its own jobs. You can also define this. This is that when a system is a mechanism through which a system is controlled by its own product is called feedback. A system is controlled by its product is called feedback mechanism. So now we're coming towards the control point. Sometimes the system is controlled in a manner which will lead your body to an unstable condition. Sometimes this control will lead your body to a stable condition. How? Like example. Now we understand further when we go through examples. In case of positive feedback mechanism, the very prominent example and very easy understanding example, that is known as childbirth. What happens in the childbirth? You know, there is the release of oxytocin. That oxytocin will cause the contraction of the uterus, and then the baby birth happens. Means delivery, childbirth. So now what is this? Why this is called positive feedback? Why this is called positive? Very simple. First of all, a stimulus is given to the detector. I mean, the baby is giving the stimulus to the uterus to contract, to move out from the body. So the uterus will start contraction by what? Then this signal will be sent to the control center that please do the contraction of the uterus. The control center will release the oxytocin. Now this oxytocin will cause the contraction of uterus. Again, signals are given. Again, release of oxytocin. Signals are given, oxytocin. Signals are given, oxytocin. So then what will happen? Oxytocin will be released in a very large amount. Enough concentration will be released, which will cause the contraction of the uterus. Now, due to two reasons, this is called as positive feedback mechanism. The very first reason, that there is enough release of oxytocin, means oxytocin is lost, its release is done time and again. One. Number two, why it is called positive feedback? Because it is moving your body to, or bringing your body to an unstable state, to an extreme state. Got two reasons. Number one, number two. it is bringing your body to an extreme condition. That's why it is called as positive feedback mechanism. We do have another examples also, like thirst. It is also coming in this context, I mean in the positive feedback, which because thirst is also bringing your body to an unstable condition. And lactation, the release of the milk, ovulation, ovules removal, release, these all are examples of the positive feedback. So this is called positive feedback mechanism. Well, now coming towards the negative feedback mechanism. This is called negative feedback instable. Why? We'll understand it through example. A very good example is, a well-known example is of blood sugar. Now what happens in the blood sugar? There are two hormones, insulin and glucagon. Insulin is actually decreasing the blood sugar and glucagon is increasing the blood sugar. We got this here, our definition. Insulin is decreasing, glucagon is increasing, because then it will bring towards a normal condition, a normal state. Normal glucose level will be obtained because of these two hormones. When any system is bringing the level a set point, then that is called as negative feedback mechanism. So here, in case of blood sugar, insulin hormone is trying to decrease the blood sugar and glucagon is trying to increase the blood sugar. So what will happen? They are working like this. First of all, a stimulus will come to the detector, means like a detector is present in the control center or which is present in the body throat. You can say to the control center, a message is given that in the body there is, in the blood, the glucose concentration is enough high. So then the control center will release the products known as insulin. So then insulin will decrease the blood sugar. So if the blood sugar gets down enough, again a signal is given to the control center. The control center will release another hormone known as glucagon, which will come and will increase again the blood sugar. So like this, a loop is obtained, a controlling mechanism is obtained, and this controlling mechanism is bringing your body to a stable state. Okay, one thing is that it is bringing your body to a stable state. That's why it is called as negative feedback. Another thing that why it is called negative feedback, because a negative feedback is being done by another product here, insulin and glucagon. Insulin is doing one way, glucagon is doing another way. So both are negating. That's why it is called as negative feedback mechanism. And that's a little bit from my side. And we'll give you another example also, like this is now blood sugar. The same, we have another example of thermoregulation in our body, and osmoregulation means temperature is also maintained by the same way, and water is also maintained by the same way by different control, by acting on different control centers in the body. So when a body is brought to a stable state, that is called negative feedback, and when a body is brought to an unstable state or to an extreme state, that is called as negative feedback mechanism. Hope so you got, or hope so it makes sense. And thank you for watching and supporting us.